Okay, so I do see it is 2 o'clock and I would like to get started. I want to say hello. My name is Danielle Daly. I am the Executive Director for IPRO ESRD Network of the South Atlantic, also known as Network 6, and very excited to bring a presentation to all of you today about emergency preparedness for ESRD patients through community partnerships. I'm very excited to announce the partnership with the Department of Public Health, the Georgia Healthcare Coalitions, and also the non-emergency medical transportation in Georgia. So I do have some peers online who will be presenting as well. Alexandra Benoit, Laura Jin, Janala Hawkins, Julia Detman, and also Kimberly McKnight. So you'll be hearing from all of them as well. And let's get started. So I do want to state some of the objectives of the meeting. We want to make sure there's good understanding of who the network is and some pieces around the conditions for coverage when it comes to emergency preparedness. Also really defining what preparedness, mitigation, and response is. We'll talk about the critical assets survey state reports, the very newly launched ESRD Emergency Hub mobile application. We will introduce our healthcare coalitions and the state of Georgia resources and the emergency management agency resources are available, as well as the non-emergency medical transportation and policies involved there. So I do want to remind everybody that all lines have been muted and we want to avoid any kind of background noise. So please know that is why they are all muted at this time. We will be asking that participants be engaged throughout the entire meeting, and please utilize chat at any time. We will be monitoring chat and answering questions. We'll have breaks during the presentation so we can address any of those questions, and that the WebEx is being recorded and it will be available on the website. The meeting presentation is already available up on the website. If you go to the esrd.ipro.org website, /events, or you can see where events is circled here, and then meeting materials. The presentation slides are already available, so if you are interested in following along, please go ahead and download those slides. So I'll tell you a little bit about Network 6, or the ESRD network of the South Atlantic. First, the mission is to promote healthcare for all ESRD patients that is safe, effective, efficient, patient-centered, timely, and equitable. And IPRO does hold 4 ESRD contracts under CMS. You can see here Network 6 covers North Carolina, South Carolina, and Georgia. There's just over 50,000 patients in that service area, about 800 dialysis facilities, and then also 10 transplant centers. And then here's a picture of me and Julia. We're part of the IPRO ESRD network team. We also function in some dual roles. In addition to being the executive director, I also deal with incident command situations for emergencies. And then Julia, who is part of our patient services team as a social worker, she is our emergency management coordinator. We'll talk a little bit about the conditions for coverage. So the survey and certification program certifies ESRD facilities for inclusion in the Medicare program. And they do this by validating that the care and services of the facilities meet specific safety and quality standards, and they're called the conditions for coverage. So the survey and certification program provides initial certification for each facility, and then there's ongoing monitoring to ensure that facilities continue to meet those basic requirements for safety. And then the link here to the ESRD Code of Federal Regulations has specific section about the conditions of participation, which relates to emergency preparedness. Now, I will say all of these links are live, so if you do download that presentation, you hover over any of these links, they are active and you're able to get to the information that you need relative to the link. So the dialysis facility must comply with the applicable state, federal, and local emergency preparedness requirements. And these requirements include, but certainly aren't limited to, fire, equipment for power failures, any care related to emergencies, water supply interruptions, natural disasters likely to occur in the facility's geographic area. And then the dialysis facility must establish and maintain an emergency preparedness program that meets those specified requirements. So the plan must include, but again, not limited to, the following elements. So an emergency plan that ensures continuity of care. It has a memorandum of understanding with a backup facility. Also a communication plan that includes the name and contact information of staff, patients, and backup facilities, Department of Public Health, Office of Emergency Management, any community partners. Training and testing and orientation, which includes demonstrating staff knowledge on policies and procedures about what to do, where to go, and who to contact. Also, making sure patients understand how to disconnect themselves, testing plans and policies by conducting drills and exercises. You can do a full-scale drill, a tabletop, a mock drill. You can do workshops, and then integrating healthcare systems. So if a dialysis facility is part of a healthcare system consisting of multiple separate certified facilities and they're affected, you want to make sure there's unified integrated emergency preparedness and that the dialysis facility can choose to participate in any healthcare system coordinating the emergency program. Now, there were some changes that were made, and the emergency preparedness guidelines have been updated. So on September 30th, 2019, CMS published updates to the Medicare and Medicaid programs, and this included regulatory provisions to promote program efficiency, transparency, and burden reduction, also fire safety requirements for certain dialysis facilities, and then hospital and critical access hospital changes to promote innovation, flexibility, and the improvement in the patient care final rule. So all of this that has been revised, all the different links are listed here as well. So please make sure that you go into our web presentation that's online and click on those links to make sure that you do understand what those current updates are. So let's talk about specifically emergency preparedness, mitigation, and response. So what is an emergency? I'm sure we're all aware of what this is. It's a serious, unexpected, and often dangerous situation requiring immediate attention. And those can happen locally. They can be at a state level, regionally, or nationally. Typically, it will impact the facility's operations. So are they closed or altering their treatment? Is it due to water or something power-related, structural? Is there a public health issue? More recently, in the last couple of years, we had COVID-19. Is there a weather event, man-made, transportation? So it's important we make sure that we have a bunch of community partners to be able to lean on during those times to help us get through the emergency event. So here's just the ESRD network and who we partner with. And you can see dialysis facilities and ESRD patients down there. But all of these entities that are surrounding the network are also your partners as well. So we want to talk about that today and how that works out in partnering and leveraging those individuals. So the network does have some basic responsibilities. We work in collaboration with the Kidney Community Emergency Response Coalition, or CAESR, and they are a national contract held also under CMS to help monitor impact of facilities and their ability to provide services. We have to make sure that there are good relationships with state emergency management officials and healthcare coalitions so we can link those entities together. And then we really work to identify challenges and barriers that impact patients and facilities and make sure that we can deploy the right resources at the right time. So more things about our role is we have to watch what's going on, activate internal staff when needed, make sure we're communicating with CMS and CAESR about those changes. We do send out email warnings and alerts with pending events that we're aware of, particularly weather events. We have to submit what's called an emergency situation status report, or an ESSR, up to CAESR, which really does go to CMS, so they understand which facilities are impacted and where patient care has been interrupted. And that CMS always needs to be aware of what's happening, so they, again, can at a national level deploy the right resources where needed. We do collaborate with local and state emergency officials, and that we want to make sure we're assuring that all patient and facility needs are being met during an emergent event. So there is a responsibility of facilities when there are some operational changes. It's important that they are reporting the closed or altered status to the network, and that's how we complete the ESSR and send that up to CMS. And there is a link here that's, again, an active link, but if you do go to our website, at the top of the navigation bar, you will see emergency operational status report. So if you do know there's a pending event occurring, whether it's weather related or even if it has to do with staffing changes, something that impacts normal operations, we do ask that you go to that link and you complete that survey to be able to provide that information to the network. And this is really kind of just some screenshots of what that survey looks like. And the reason why that's necessary is because, again, we do have to report that up to CMS. We often share that information with our state officials, even healthcare coalitions, if it gets to a point where there is something that is widespread. It helps to assist with patient placement if needed, and then it really does provide that good situation awareness. And then just a note here that the facility should be also communicating any of these changes also with the Department of Public Health, so they are aware too. Another thing that the network conducts annually is a critical asset survey, or what we call the CAS, and we do collect that information around April, June, or we did at least in this current year. And it helps us to understand the capabilities and resources at the facility level. Whether or not you have been in contact with your healthcare coalitions, do you have a generator on site? What is your backup water supply? Who is your backup facility? And I'm happy to say that that report is now available online at any time, where it's not just an annual collection. You can keep that updated in real time and also make sure that your emergency plans are updated. And that's through the IPRO ESRD Facility Information Management System. Again, the link is here, but you can always reach out to our network staff if you need to get to that system directly. And it's used by the network emergency management team, the state health departments, and the OEMs and the healthcare coalitions, because it helps us to best support facilities during an emergency event. There was an activity that was conducted in IPRO Learn, for those of you who are part of that. That was done in September. And again, we can link you up to that live form if you need that. I am going to turn it over to my colleague, Julia. Julia, you do have the ball, and I'll have you share a little bit more about that critical asset survey.
Thanks, Danielle. So we are currently working to generate a critical asset survey summary report, which will be individualized by state. The summary report is going to be really beneficial for our state and coalition partners, as it demonstrates a really visual representation of all the information that you guys submitted to us. It's also going to be shared with an Excel spreadsheet, so users can really dial in on areas specific information like affiliation, like Danielle said, generator availability. So I wanted to show an example of what the report looks like based off of the information we gathered. So of course, this is Georgia, broken down by affiliation. And as you can see, larger cities like Atlanta have a huge concentration of DaVita and Freseniuses. So if there's an emergency at one clinic, there's likely a backup or a sister facility nearby. Once you go a little further outside of the city, you can see how much more difficult it may be for patients to find a place to treat if their facility experiences a localized natural disaster. Again, this is information for Georgia, and it's a really great visual of facility census by affiliation. It identifies facility count, total patient census at each affiliation, in-center patient census, as well as home hemo patient census. So this slide starts to identify backup capabilities by affiliation and which facilities have a generator versus those who don't. This information really helps us when there's a storm or an emergency that affects only a certain region or county, and helps let us know which affiliation needs the most support. And this graph also shows which affiliations are providing emergency education to patients based on frequency. And as most of you know, you are able to choose multiple options when completing this. So a lot of facilities, for example, provide education to patients quarterly and prior to the event. Okay, so the ESRD Emergency Hub mobile app, which Danielle mentioned earlier. So the ESRD Emergency mobile app is something we're really excited to present to both patients and providers. It's free and was created by an expert team, which did include patient weigh-in to make sure that it's really catered towards the user. This is just a quick look at what the app home screen looks like upon download. We send out emergency alerts based on county, which the user subscribes to upon download. So for example, with Hurricane Ian, we did send out an emergency alert to any areas we anticipated may be affected. The app has things like emergency resources, how to create a to-go bag with dialysis essentials, a 3-day emergency diet plan, evacuation information, where they can find their closest medical needs shelter, and a lot more. We really hope that patients who utilize this app will feel a lot more prepared in the event of an emergency or in prepping for an emergency. So these are the patient and professional flyers, which we will be sharing next month, that can be hung up in your facility or handed to patients in order to get more people to download it using the QR code. We're really hoping that you could display this information throughout your clinics so we can reach as many patients as possible. There's also this short video that can be displayed to patients in the lobby or chairside. It gives patients a really quick idea of how the app can benefit them in the event of an emergency. So we really hope that you'll all promote the use of this app in your clinic. The video is available on YouTube and also on our website. So I really encourage you all to check it all out if you can. It's really well done. It gives a really good example of how this might be useful to patients or even family members. Okay, any questions?
So Julie, I am monitoring chat and I'm not seeing any other questions come in other than somebody did ask for the CAS, the link to be put in the CAS. So I have gone ahead and put that in there, as well as a link to the presentation slides and the ESRD Emergency Hub mobile application. So I hope everyone's seeing those. If you're not, please put that in chat. And then we are also going to continue to encourage people to use chat as an area to ask some questions. So again, the lines are muted, so please ask any questions through chat. Julie, if you can advance the next slide, and I'm going to drag the ball to our next presenter, who is Alexandra Benoit. So Alex, you do have the floor.
Good afternoon, everyone. My name is Alex Benoit, and I'm the Vulnerable Populations Coordinator at Georgia Department of Public Health. So who are we? DPH, we partner with a lot of different healthcare organizations, state, federal, and local agencies. And our goal is to really ensure the continuity of operations to Georgia's healthcare systems during an emergency. It does not matter the type of emergency, whether it be something that is affecting our whole nation, our state, a region, a part of our state, or it can be something that is facility based. Our goal is to ensure and to help our facilities keep the continuity of operations for our healthcare systems in the state of Georgia. So who do we work with at Department of Public Health? I work under the Office of Emergency Preparedness and Response in our Healthcare Preparedness Program. Our Healthcare Preparedness Program is funded through the Administration for Strategic Preparedness and Response, which is ASPR. And ASPR sits under Health and Human Services. So this is our goal. Our goal is to ensure that Georgians have access to the critical medical care before, during, and after any disruptions that affect our state. So who do we work with? We work with a whole plethora of partners. I don't have enough room on the screen to put every single logo up for every single organization that we work with. However, we have a strong relationship with Department of Community Health. We work with the Kidney Community Emergency Response Organization, Georgia Emergency Management and Homeland Security Agency, Georgia Hospital Association, and of course, the End-Stage Renal Disease Network 6. Those are some of our closest partners that we work with to ensure that we are communicating with our dialysis providers throughout the state. So we always look at all of Georgia's hazards and vulnerabilities when we look at the continuity of operation, and we assess the continuity of operations in our state's system. So Georgia faces a plethora of different type of natural and man-made disasters. Some of our vulnerabilities in Georgia are hurricanes, tornadoes, floods, wildfires, hazardous material spills, winter weather, and of course, disease threat. COVID-19 has really shown, and we have prepared and planned for, of course, any pandemic or disease threats that may affect our state as well. So we're going to talk about healthcare coalitions, and I'm joined by Janella Hawkins and Laura Jen. Laura Jen is the Healthcare Coalition Facilitator for Region M, and Janella Hawkins is the Healthcare Coalition Facilitator for Region N. And I'm to have them speak a little bit about our healthcare coalitions in the state.
Hello, everyone. I'm Janella, And I'm going to talk to you right now about our healthcare coalition. So what is a healthcare coalition? It's a collaboration of network of healthcare organizations, of response partners. We basically bring together multi-agency and multidisciplinary groups and individuals who work together to promote, consolidate, and collaborate in a unified response to emergencies that affect our area. And our goal, again, is to collaborate, to communicate, to coordinate with partners and organizations just to ensure the continuity of operations throughout the region. Again, it could be something that's an individual facility, it could be something in our region, it can be something that's state, and then there'll be a few organizations, a few coalitions that work together. Next slide, please. Our coalition overview is there are 14 healthcare coalitions throughout the state of Georgia. We are technically titled as Region A through N in the alphabet. Each one of the coalitions have a regional coordinating hospital, and each one has two co-leadership besides our executive committee. We have one healthcare coalition facilitator that is housed under public health. And then we have one coalition coordinator, which is the person that works at the regional coordinating hospital. Our job is to plan, train, exercise, equip, response, coordinate, communicate, bring it all together. That's our job. And then we do have one specialty coalition, which is CHOA. They take care of all of our pediatrics. Next slide, please. So when I just talked about a coalition coordinator and a coalition facilitator, the coalition coordinator is the person that works at the hospital, and the coalition facilitator is the person that works at public health. The person that works at public health, it's their full-time job. This is all I do is coalition. All I do is multidisciplinary agencies. All I do is multi-agency. So I'm here to help you in an emergency, help you with your plans, read you through your plans. Your representative at the hospital is also there to help too, but they're full-time at that regional hospital. So if they do have emergency that comes up with that hospital, unfortunately, that has to take precedent. Next slide.
I think this one's me. Hi, everyone. This is Laura. So I'm going to talk about some coalition-sponsored activities. Kind of like Janella mentioned earlier, we do regional coordinating plans. So one of those things, it means all our pieces and all our community partners kind of fit together. We host quarterly meetings. We offer trainings. We do regional exercises, and it covers everything from transporting patients, decon, severe weather. Where I am in my region, we do a lot of regional exercises for evacuation and sheltering. We purchase items from regional caches, so portable air conditioners and heaters, generators, fans, PPE, moulage supplies, emergency lighting, weather radios, water purification systems, and backup water systems, just anything you can think of. And the beauty of all this, because every coalition is different, we can have caches of items that are specifically needed for our coalition, for our region. It's really, really locally based on what we need. And the trainings I host are very different than the trainings Janella may host. My coalition just hosted an emergency response for farm equipment because I'm in a very rural community. So we deal with a lot of farms and farming equipment. We need that kind of training locally. That's not necessarily something that would need. So it's a great thing as far as activities go. Next slide.
So in the emergency preparedness community, all emergencies start locally first. If it's just your facility, that's where your emergency's housed. If it's our local area being your community that you live in, basically. It's the health department that's there to help. It's your county EMAs that's there to help. It's your local community partners, your disaster nonprofits that are there to help. On the regional level, it's the healthcare coalition. Then we go to the state level, and that's state public health. That's GMA, that's GBI. That is also your DCH healthcare facility regulation that holds your license. And then we also have the federal. So federal, that's when you get into FEMA and CDC and FBI and HHS, the Department of Homeland Security. So if you have an emergency that's happening locally, you would not try to call your GMA representative at the state. You've missed a whole bunch of steps there of places of where we're able to help you. You would start with your local community first. If you're in Cobb County, where I am, you're going to start with Cobb County. If you're in Atlanta, you're going to start with the city of Atlanta or Fulton County. If you're down in our southern areas and you're in Savannah, you're going to start with Chatham County. That's where you start first. And in turn, you will reach out to your regional coalition. You would never jump to automatically calling GMA, automatically calling your state DCH for something when you've skipped all those steps in emergency preparedness. Next slide. So when you're contacting your local coalition, again, there's 14 local coalitions, A through N, and then we have a specialty of CHOA. You're contacting your healthcare coalition facilitator, all of the MEs, or you're contacting your coalition coordinator, which is your hospital representative. Next slide. Here's a list right here, and we keep this up to date because, yes, unfortunately, people go into other positions, but we do keep this up to date and tell you where there's a vacancy. If you do see a vacancy on this list, just call your coalition coordinator and they can get you the same help. It doesn't mean that anything has been laid to the wayside. It just means we're in the process of hiring someone for that position. So these are the coalition coordinators and facilitators around the state, including PEDS for CHOA. They're Region D, which is one part of the Metro coalitions. I'm Region N, I'm the other part. Region D holds more of the Metro counties. So they have 8 Metro counties when I have 4. So there are 4 healthcare coalition facilitators there because 4 of our larger counties is with Region D. And then I'm Cobb County, I'm one of the 5. So they have 4 coalition facilitators within that county. They have a little bit more hands-on because the metro area, unfortunately for us, in the metro area alone is 6 million people in population. So, and then we have the rest of the state, and the state is 11 million in population. So that just gives you how we divide up things when it comes to our coalition facilitators and our coalition coordinators. So next slide.
So now we're going to talk about how our dialysis providers can connect to their local emergency management agency.
Okay, so hi everyone, this is Laura again. I'm going to talk about emergency management agencies, which are EMAs. Sometimes you'll see them labeled as EMAs and Homeland Security, or they may be connected to a fire, police, or sheriff's office as well. So next slide, Alex. All right, so emergency management agencies, they're your lead county organization responsible for providing management and coordination during any emergency. So they mitigate, prepare, respond, and recover any activities that are within its local area of responsibility. And they are kind of your go-to locally, whether it's a local or it's a regional or it's a facility based, depending where it is. They're kind of your go-to for communication and requesting things, and they're the ones you work with the most. Next slide. Where this comes into play is because Georgia is a home rule state. What that means is all disasters start locally and end locally. So even if it's something like a large scale event, like a large scale weather event of some kind, everything's going to start locally. It's going to start with your local EMA, and it may grow and it may go into something where we see response from DPH, GEMA, which is Georgia Emergency Management Agency, and it may grow, and it, depending on the size, it may go into a federal level event, but then it'll still come back down and it's going to end locally as well. Everything starts locally, ends locally. State only gets involved if an incident exceeds the local regional ability to handle an event. And that's the same if it gets to the FEMA level. That's only if it outgrows the state level of of things. But when things get wrapped up, long-term events, especially weather events, it's going to start locally, and the wrap-up process is going to end locally as well. So next slide.
So we can talk about who would our dialysis facilities need to contact if you need assistance. So of course we know that you would always want to contact your corporate leadership first. However, as Laura stated, all disasters are handled locally. So it's very, very important that all of our providers reach out to your county EMA to inform them of any type of disruption of service in your facility. Even if it's something that you are handling and managing on your own, it is always important for our EMAs to know what's going on in their respective counties. That is very important. Also, your third point of contact we recommend you to do to contact is your end-stage renal disease network 6, which will be Julia and Danielle. Make sure that you're contacting and informing the network of any disruption of service, because we do work in a cycle. So even if we don't hear from you on the state level, Julia or the end-stage renal disease network, Julia and Danielle will definitely disseminate that information down to the state, and we'll make sure that our coalition leadership knows as well. However, we would hope that your fourth point of contact would be your coalition facilitator, so that they are aware also of what's going on within their region. It is very important, and sometimes, as stated earlier, the resources that we have on our local level in our state, within our counties, they can help you manage or help with the issue that you're dealing with within your facility. So you may not have to go to, you don't always have to lean just on your corporate leadership or the state or federal partners. Sometimes our local partners are able to handle and manage your incident or the incidents that are going on within your region. So it's very important that you have those relationships with your county EMA and your healthcare coalition facilitator. So speaking of fostering relationships with your EMA, we always recommend that facilities reach out to your EMA before there's an emergency situation. Get familiar, invite your EMA for lunch at your facility, invite them to tour your facility, look at their hazard vulnerability analysis. As Julia and Danielle stated previously, all facilities have to have an emergency plan, and that is mandated by CMS. And so a lot of times our coalition and our EMA work together to do hazard vulnerability analysis that are specific to their region in which they're located. So you can lean on your coalition partners and your EMA to make sure that you are assessing and that you have an idea of all vulnerabilities that may affect your facility depending on the region and area in which you're located. Please make sure that you're contacting your EMA and invite them to any exercises that you have. When our coalition has coalition-sponsored exercises, the local EMAs in their region are there. So that is a good way to meet your EMA. Going to your coalition meeting, going to your coalition-sponsored activities and classes will be an excellent way to initiate that relationship, and then invite them in to your facility so that you can have an idea of how to communicate with your partners.
So this is Laura again. I'm going to talk to you guys a little bit about how to locate your county EMA in case you have not done so before, or things have changed, because like everything else, they've had turnover as well. So this shows a map of all the regions with the state, with the Georgia Emergency Management and Homeland Security Agency. As you can see, they're numbered 1 through 8. And if you go to the GEMA website, which is when you guys all get the presentation, I think Danielle has posted the link in the chat already. So it'll be an active link, and you can click on it and it'll take you to the map and for who you're looking for. Also in the box in the top corner, it's kind of hard to see in that slide, but it has a list of who the GEMA field coordinators and the Homeland Security coordinators are as well for each region. So this is what it looks like when you go to the GEMA website, and you can see the circled box in the middle. It says local EMAs, so you'd click on that. The next slide. And then you can search it by county. So you can use a live search, or you can scroll down the list. All the counties in Georgia are listed in alphabetical order, and it has an address. But when you click on it, it'll pull up their name and all their contact information, all that good stuff. So it'll have everything you need for finding your local EMA.
Next, we'll talk about the resources that our state of Georgia has for our dialysis partners.
Hello, everyone. It's Janella again. So one thing I want to tell you about a great resource we have is Everbridge, our Everbridge notification system. So Everbridge itself is a database that can be used to send out messages to large groups. It is very easy. It saves you so much time. And on top of that, it kind of eliminates, it replaces those phone trees that you had to have everybody take a part of the alphabet of staff and call them. And then if you didn't reach their home, you're calling them on the cell. And if you didn't reach the cell, then you're trying to call this emergency number. Everbridge system actually will take care of all of that. You would actually plug in all of that information ahead of time for each person. And in turn, you will tell the system, I want you to call the home, the cell, and back in the day when we had pagers, I want you to page them. You can tell them whatever you want it to do. I want you to email the person. And what the system will do is that it will contact that person. You put in an order of what you say the priority, the secondary, and tertiary is. And then in turn, it will contact that person in that order. The person has to respond. So if they're not home and they didn't get that message, fine. They're going to call the cell phone. They have to respond to the message. Then you know that they got it. You also can go back and look and see who responded to the message, who didn't respond to the message. You also can go in and see, oh, I had Susie Q's wrong number in there. So this is why she didn't respond. It will also tell you when something was undeliverable. It's a great system that we have. It is managed by GHA. And if you have any questions about Everbridge as a dialysis group throughout Georgia, you are able to use this system. And we have the contact information for Mallory Garrett at the bottom of this slide. Next slide. And like I said, for GHA, GHA is our Georgia Hospital Association. They are a great partner with our coalition. They are with us 24/7. And again, GHA 911 is where the coalitions house our information. So we put on there the calendar trainings that we're doing, the calendar meetings that we're having. You can find our coalition plans. You can find our coalition HBAs. We have to do all the plans and have a hazard vulnerable analysis just like you do. We have to have it for the region. And if you ever needed that or wanted to see it, it's all on GHA911.org. You do have to sign up and you can register. Once you register, you can see everything. But again, if you have any questions or need any information on GHA 911, Mallory Garrett is the contact information at the bottom of the page.
And another resource that we have is a federal resource. ASPR Tracy is brought to you by HHS and Administration for Strategic Preparedness and Response. TRACY stands for the Technical Resources Assistance Center and Information Exchange. And this was created to meet all the requirements and meet the needs for information sharing within the nation, really. So they also have a section that's specifically for dialysis as well. And you can find a whole plethora of tools, resources such as dialysis checklists for disaster areas, post-disaster operations templates, plan emergency preparedness and disaster plan templates, and articles on lessons learned specifically for dialysis organizations. So this is open, it's free of charge. You can get all of these templates on ASPR Tracy, and this is specifically for emergency preparedness, and responders. This is specifically for you as a healthcare provider. This is for our healthcare practitioners, our coalition partners. So anyone who works within our healthcare system within the country can go and utilize the resources at ASPR Tracy. So there's a link, and the link will be in the presentation so that you can go and look at the technical resources topic collection that is for dialysis centers on ASPR Tracy. That is the end of our section of the presentation. If you have any questions, we are open to any questions, and thank you so much.
Thanks, Alex and Laura and Janella. I have been monitoring chat, and I have been putting in all these wonderful links that you are providing in the slide deck. So for participants, if you are on the actual WebEx and not just calling in, please go into chat. All these wonderful things are here, and links are available at your resource. And I am going to drag the ball to Kimberly McKnight, who is our last presenter of the day, and she's from the Non-Emergency Medical Transportation Organization. So Kim, you do have the ball and you can advance the slides.
Danielle. Good afternoon, everyone. I am Kimberly McKnight, and I'm the NEM Department of Community Health. So our mission at DCH is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. The purpose is to shape the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities in which we serve. So what is NEMT? The Georgia Medicaid Non-Emergency Medical Transportation Program provides medically necessary transportation for eligible Medicaid members who have no other means of transportation available. And most members who are receiving Medicaid usually qualify for NEMT services. The only exception are qualified Medicare beneficiaries, which are listed as QMB, excuse me, unless they have dual eligibility. Otherwise, the majority of the Medicaid recipients do qualify for NEMT services. Transportation is provided only to and from Medicaid reimbursable services for the purposes of receiving medical treatment, evaluations, receiving the prescription drugs, pharmacy trips, and receiving medical equipment. So for the purposes of NEMT service, the state of Georgia is broken into 5 regions. We have 2 NEMT brokers serving the state, and our NEMT brokers are responsible for providing the transportation through transportation providers. Motive Care, formerly Logisticare, serves the Central, East, and Southwest regions. Southeast Trans, our other broker, serves the Atlanta and North regions. Our next slide is a breakdown of the NEMT regions and counties served in each region. So along with the contact information for each broker. And these contact numbers here are specifically for scheduling transportation. And scheduling transportation for dialysis members is usually done with a standing order, which means that it's a set time for 3 days of service a week. So both brokers for the state of Georgia have 20 plus years of experience in NEMT, and they understand the life-saving service dialysis treatment provides to eligible members receiving NEMT services. Each broker provides thousands of dialysis trips annually to ensure our members receive their life-saving treatment. To give you an idea of the number of trips the brokers transport, in the state fiscal year of 2022, which is from July 1st, 2021 through June 30th, 2022, our brokers transported actually over 1,818,706,000 trips, almost 2 million dialysis trips within a year. These numbers include our levels of mobility of ambulatory, wheelchair, stretcher, bariatric stretcher, and public transit members utilizing NEMT for dialysis. And I would also like to mention the public and the mass transit is also paid for through the broker for eligible NEMT members. Members just need to contact the broker in order to get their schedule so that they can receive either passes or tokens to pay for their public transit. And this slide represents the trips by region and mobility for the fiscal year of the amount of trips that we just discussed. So it is important to note some of the training NEMT drivers receive and the policies associated with NEMT services. All the drivers used for transportation or by the transportation providers deliver transportation services under the NEMT program must have successfully completed driver training, which includes first aid training, passenger assistance, defensive driving, safety and sensitivity training, wheelchair securement, first aid and CPR, use of the spill kit, removal of vital hazards prior to driving under the NEMT program. The NEMT providers also supply, again, the level of mobility that we supply transportation for is ambulatory, wheelchair, stretcher, bariatric stretcher, excuse me, bariatric stretcher members according to the member's level of service. So those level of service are broken into 3 categories. The ambulatory transportation is curb to curb, which means that the member should be able to ambulate to and from the vehicle without assistance. If assistance is required, we ask that the member have an escort transport with them. Wheelchair transportation is door to door. So we'll pick them up from their residence, take them to a common area or the lobby of their destination. Transportation providers are not able to transport members or take them to like the third floor of a building to a medical appointment. So if that assistance is needed, we ask that they have an escort traveling with them. And then stretcher transport is bed to bed. Continuing with the NEMT policy, I just want to reiterate that the NEMT drivers are only responsible for transport to and from the member's appointment. NEMT drivers are not medical personnel. It is the responsibility, though, of dialysis facilities to furnish all necessary equipment, supplies, and dialysis services. This includes the receiving facility having the needed manpower and/or equipment on site to weigh members and transfer them to the dialysis chair. And I bring that point up because we've had some issues and concerns with transportation providers supplying weight for the member and having to weigh them. Again, drivers are just that for NEMT. They drive, they are not medical personnel, and we want to make sure that the information that the dialysis facility is receiving for their dialysis member is accurate. And we don't want too much fluid taken off or whatever the case may be because of information received by the facility from the driver. So stretcher members are required to have a letter of medical necessity signed by a physician or an RN for dialysis standing orders. Continuing with the policy as far as the stretcher transports, again, we have concerns that we receive for stretcher transportations. So I just want to make sure that you all are aware. The NEMT brokers contract with transportation providers to supply transportation to and from medical appointments only. Transportation providers are responsible only, again, for the transportation, loading, and unloading of eligible Medicaid members. Transportation providers are not required to remain with the member at the treating facility, and the transportation providers are not required to leave their stretchers with the member at the treating facility. Any additional requirements, including the availability of accessible medical equipment to meet the needs of the patients, are the responsibility of the treating facility. And as we remember, when it comes to emergency situations such as inclement weather or transporting during a pandemic, dialysis trips are triaged as our priority number one for NEMT services. When the pandemic started and the state shut down, dialysis members were still receiving treatment. Both brokers worked with transportation providers who were equipped to transport COVID positive members with the appropriate PPE. Each broker also has a small fleet of vehicles in which is utilized during emergency services. So again, dialysis is treated as priority number one. Other trips usually are canceled during those emergency services. So our focus is really making sure that we can get our dialysis members to and from their appointments. So, and during those times of inclement weather, with snow or ice, we ask the Georgia Department of Transportation or the facility to clear the entrance and parking lot to the dialysis facilities. For safety reasons, transportation providers will usually wait until sunrise to drive during snow and ice events. We also recommend dialysis facilities communicate with the NEMT brokers regarding time changes and closures. This will allow the brokers to communicate changes to the transportation providers timely and also allow the brokers to supply transportation using their fleet and trying to make sure that everyone gets to where they need to be timely and safely during these emergency situations. And the brokers have also trained with GEMA, working with them to prepare for weather emergencies in the state. And as stated before, we partner with DPH, and we want to make sure that we are partnering with each facility so that we have a plan of action and that the communication is clear. So in speaking of partnering with our dialysis facilities, we have a dialysis work group that we are putting together. We have currently partnered with the NEMT brokers, the adult day health community, and the skilled nursing facilities. through work groups. The purpose of these work groups is to just work through some of our systemic transportation issues, and we are looking to do the same with our dialysis partners. I am interested in hearing from any of you who would love to partner with us to join the dialysis work group, to discuss any situations, to work through resolutions, excuse me, for your concerns and anything that you may want to share with the brokers to better serve your clients. If you are interested in doing so or would like more information about it, please feel free to email me or call me at the information listed on the slide. And as has previously been stated, both brokers also we have advisory committee members or meetings, which we would love for dialysis facilities to participate in. I think that's a great forum for you to share information with the brokers and the NEMT provider network. We also have quarterly meetings from DCH with the brokers. So if there's any information that you would like to share, or I'd love to invite you to be a participant in one of our quarterly meetings in order to share information. Again, feel free to reach out to me. I would love to have you and to partner and gain more insight into what is needed from the dialysis facilities for our NEMT services to provide the best service for you and your clients. So if you have any questions, suggestions, or complaints about the NEMT program, please contact us. We are a team of 3 currently. Tanya Malcolm, who is our customer service compliance monitor, Stacy Ramsey, who is also a compliance monitor, or myself. Here's their contact information. Feel free to reach us at any time. I thank you for your time and the opportunity to speak to you all. If you have any questions, I'm available to answer. Thank you.
Thank you, Kim. I do not see
You're
any
welcome.
open questions right now in chat, but there certainly is an extra moment for anyone to put something in there if they would like to get some questions answered. I do want to extend a really sincere thanks to our peers, Alex Benoit, Laura Jin, Janella Hawkins, Kimberly McKnight, and then also my colleague, Julia Detman. Emergency preparedness is really a team sport, right? So it's important that we know who our team members are in these occasions, because we can't stop disasters, but we can really arm ourselves with knowledge and also community. So we do hope that this information was extremely informative to all of you, and that you were able to capture some resources that are available, as well as information about how to contact individuals. There is one question here that says, will the webinar be offered on another date for those who weren't able to participate? This is just the only live event. However, it will be recorded, and the recording will be on the website in that same place where the PowerPoint slides are being provided. So if you do have colleagues who were not able to participate, we do encourage that they do go on our website under the events and meeting materials. I did drop that link back in chat again. We also do have a post-event survey. We really want to know if this information was helpful and valuable to the community, how we can best serve you. There is even an open-ended question about how can these community partners best support facilities prior to and during an emergency event. Your feedback is extremely helpful to us to make sure that we can best service the community. So I thank you all. We'll give you back a few minutes of time, and please complete that survey upon your exit. Thanks, everyone. Have a wonderful day. Thank you, speakers.
Thank you.
Thank you.